What is a skin prick test for child allergies? Imagine finding out what makes your child sneeze or itch. A skin prick test is a simple way doctors use to discover what allergens might be causing those reactions. It's a safe and quick procedure that helps identify specific things like foods, pollen, pet dander, or dust mites that could be triggering allergies. During the test, the doctor places tiny drops of allergen extracts on your child's skin, usually on the forearm or back. Then, they gently prick or scratch the skin through each drop. This allows a tiny amount of the allergen to enter just below the surface of the skin. The whole process takes about 15 to 20 minutes. If your child is allergic to a substance, the immune system reacts by releasing chemicals that cause a small raised bump called a wheal. This bump is usually red, itchy, and can be about the size of a small pea. The doctor measures the size of this bump to see how sensitive your child is to that allergen. It's important to remember that a larger bump doesn't necessarily mean more severe allergies, but it does show sensitivity. This test is especially helpful for children because it can quickly identify common allergies like food allergies, pollen, pet dander, or dust mites. Knowing what causes allergies allows parents and doctors to develop better plans to avoid triggers and manage symptoms. The test is most accurate for children over 6 months old, as testing very young infants can sometimes be less reliable. The procedure is very fast and causes only mild discomfort, similar to a tiny scratch or pinprick. Sometimes the skin might itch a little afterward, but it usually doesn't bleed or cause pain. Before the test, the doctor reviews your child's medical history and may ask about medications your child is taking. Some medicines, like antihistamines, can affect the test results, so they might need to be paused under medical supervision before testing. It's important to understand that a positive skin prick test shows your child is sensitized to an allergen, but it doesn't always mean they will have severe reactions. The results are always interpreted alongside your child's symptoms and history. If the test is negative, it's a good sign that your child is unlikely to be allergic to those substances. In summary, a skin prick test is a safe, quick, and effective way for healthcare providers to find out what might be causing your child's allergies. It helps guide treatment and prevention strategies, making it easier to keep your child comfortable and healthy. Always consult a healthcare professional to interpret the results and plan the best course of action for your child's specific needs.